So my presentation is called Inpatient Rehabilitation Unit Fall Prevention Policy, and it's on the policy at Peace Health, and it's about falls, and I have a picture here of a little girl who's falling, and older people do not recover as well as little kids. So the learning objectives for my presentation: the listener will describe the fall risks for inpatient rehabilitation units. The listener will be able to describe reasons for increased falls on inpatient rehabilitation units and the results of client falls, and as well multifactorial fall prevention program and the fall risk assessment tools. So this slide has a link to a video to St. Bernarba's Hospital Fall Prevention Program, and it's similar to the, well, a lot of hospitals have fall prevention programs like this one they present, so you can either watch it now or watch it later. So I'm moving on. So the overview of my presentation. Fall rates happen to be higher on inpatient rehabilitation units. Between 10 to 50% chance a client will fall at least once during their hospitalization on an inpatient rehabilitation unit. So Peace Health does not have a fall prevention policy specifically for rehabilitation units. They just have a system-wide policy. The rehab unit, I think, may benefit from a policy specifically for inpatient rehab units, or a way to incorporate more assessment data into fall prevention programs for rehab clients. Because, well, fall prevention programs, they help decrease fall rates and keep clients safe. So the consequences of falls affect both clients and hospitals. So falls can result in mild to serious injuries and potentially death. After a client experiences a fall, they sometimes develop a fear of falling, which leads to decreased independence. Clients tend to not be able to trust themselves to maintain their balance. And in addition, hospitals can end up eating the costs of a fall, because Medicare does not pay for falls that occur in the hospital. That cost can average $17,483. So there's a lot of reasons, obvious reasons, to prevent falls. We don't want clients to be injured. We want to keep them safe, and also to save hospitals money. So who are at risk of falling? So there are many reasons people fall and causes of falls. So one of the biggest fall risk factors is cognitive impairment. There are arthritis, decreased physical activity, environmental hazards such as slippery floors and other items that are on the floor that shouldn't be, or just people tripping on things. A history of dizziness or fainting, impaired gait, joint or muscle restrictions, Parkinson's disease. Medications can cause falls, like opioid medications, benzodiazepams, antihistamines, heart meds, anticonvulsant medications, and vasodilators among some. Poor posture, peripheral neuropathy or decreased sensation in the feet, which would be maybe from diabetes, and then stroke. So rehab unit patients, a lot of patients are there due to strokes, amputations, brain and spinal cord injuries, and rehab units have a higher number of clients with these sorts of problems. So to me it looked like in the research that that might be another reason why there's higher fall rates in inpatient rehab units. So my next slide is of a picture that I think illustrates someone at risk of falling. So, and it's showing a nice way of how they're someone has, or some people have put up poles to help this tree not lose some of its big heavy branches. So here's Peace Health's fall prevention policy and fall prevention care plan. And the policy is a system-wide policy. The scope is all patient care and nursing units. So the policy is not specific to rehab units, but it applies in rehab units. So the policy uses a tool that is called the Peace Health Fall Risk Assessment Tool that they use to identify clients at risk of falling. And then once they've identified someone at risk of falling, they use the care plan that includes the multifactorial or comprehensive plan, which I found in my research that a multifactorial approach helps prevent or decrease falls, because falls happen for so many reasons, and so this covers, I try to cover as many areas that people may fall. So what is the value of identifying clients at risk of falling? So when clients are identified as high fall risk clients, the nursing staff is able to develop a fall prevention program specifically for that client. It allows staff to share fall status with each other to prevent falls. And so these two, the Morse Fall Scale and the Fall Risk Assessment, are tools that are used to identify clients at high fall risk. The fall risk assessment on the left-hand side is similar to what the hospital uses, that they call the fall risk assessment, Peace Health's anyhow. So there's some items on there like history of fall, age, mental status, and agitation, and then the Morse Fall Scale. It's not used at Peace Health, but it is commonly used. And so I'm moving on. So do fall risk assessment tools help predict client falls in inpatient rehabilitation units? So some studies have shown that I've found that the functional independence measure scores are a better predictor of falls. So the functional independence measure, which I'll just call FIM, it is used in rehab units to assess a client's response to inpatient rehabilitation therapies. So it measures cognitive and motor functioning. So the way it's scored is a score of 1 indicates the client is completely dependent actually on caregivers for the particular area being graded. The score of 7 indicates the client is capable of functioning independently in the area being graded. So there are 18 areas that are scored. And so the highest score is 126, I believe. So they found that low FIM scores correlate with high fall rates. So when someone is scored, you know, less than 7, closer to 1, they're at a higher risk of falling. And high FIM scores correlate with low fall rates. So someone who is more independent has lower fall rates. So this is what it looks like. So there are 2 domains that are measured, the motor and cognitive domains, and the 18 areas, different measurements, broken up. The motor, which is all related to, you know, ambulation and transfers and just those sorts of things, and then cognitive domain, problem solving, memory, comprehension, expression, and at the bottom there it tells you how it's scored, the numbers, what they mean. Okay, so the first article here I'll talk about is called Comparison of Fallers and Non-Fallers at an Independent and Rehabilitation Facility, a Retrospective Review. So the researchers found considerable differences in FIM scores upon admission between clients who fell and those who did not fall. So, so the same group of clients who fell and did not fall had similar Morse-Fall scale scores. So the researchers here concluded the FIM's cognitive and motor independence measures were a better predictor of fall risk than the Morse fall scale to identifying high fall risk clients. Okay, let me see. So, slide. Falls on an inpatient rehabilitation unit. Risk assessment and prevention article. So again, this is this article looked at FIM, and they found that total FIM score, motor score, and cognitive scores all showed significant correlation with rate of falls for the clients in the study. So they found that 1 additional point to either the motor FIM or cognitive FIM scores decreased the chance of falling by a factor of 0.949 and 0.925% respectively. And while the numbers confuse me a bit, I found it interesting that 1 point does decrease the risk of falling, and so just gets better with higher points, more points. So the researchers suggest FIM scores are useful to knowing the case mix of clients on a unit. So my last article here is called Identification of Patients at Risk for Falls in an Inpatient Rehabilitation Program. So here we go. They found that expression FIM scores, the lower expression FIM scores at admission for clients who fell compared to those who did not fall. Oh, wait a minute. I have to. So they found that, did not fall. So lower expression scores, wait a minute, I'm lost here a second. So they, some scores in other areas did not show differences between. So people with lower expression scores, they were found to have higher fall rates, and because they're unable to express their needs, which would be, I was thinking people like who have aphasia due to strokes or other reasons they're not able to communicate, are at greater risk of falling. They, in this study, they did not find that the other SCIM or FIM scores showed a big difference between clients who fell and clients who did not fall. And interesting, the Morse fall scale scores, they said, were found to be ineffective since most patients were identified at high risk for falling. So it really didn't help there. So the impact on nursing. So Peace Health here in Bellingham, they currently do use FIM to assess clients, and they score clients typically, well, this is what I was told, for the first 3 days of admission, and then the last 3 days the last 3 days they're there. And so then they use those scores to evaluate how well they progressed and how well they responded to therapies while they were in the rehab unit. And so FIM scores, I say here, could potentially be used in client fall prevention programs on inpatient rehabilitation units. So the conclusion here, I talked about fall risks for inpatient rehab units. So such things as what I said earlier, people with amputations, strokes, brain and spinal cord injuries. There's a higher number of patients with those problems. Reasons for increased, there tends to be more patients with higher risk factors for falling in rehab units. And the results of falls are many and not good ever. And we talked about multifactorial fall prevention programs like the care plan that Peace Health has, and fall risk assessment tools like the Morse fall scale and the fall risk assessment tool that's similar to what Peace Health uses, and also talked about FIM, although that's not for identifying clients at risk of falling. So it may be prudent to Peace Health to develop a fall prevention policy specifically for inpatient rehab units that included the FIM and help benefit clients and reduce or decrease and prevent fall rates. All right, thank you for listening.